SET, or signal extraction technology, is our first invention at Masimo. It is the first technology that takes pulse oximetry to what is known as modern pulse oximetry today, which is a pulse oximeter that is accurate and reliable even during motion, even during low perfusion.
One component of that is its wireless capability was really quite attractive to us. That really helped us prime the pump when we were looking at ways to monitor patients in alternate care sites to use the Masimo technology.
So we began thinking, what can we do for patients at home? And one day at one of our meetings, we said, hey, let's get a hold of FDA and see if they want us to take this to hospitals to transfer their patients to home that they don't have room for, that don't need ICU care immediately, to monitor them remotely with COVID.
As COVID spiked, we had a need with respiratory conditions in particular for patients. We had capacity constraints, and we knew that patients needed to be isolated. So those reasons in particular were drivers for why remote monitoring was an ideal solution for us to still deliver optimal quality care for the patients, but doing it in a fashion that's convenient and best from a public health perspective as well.
I don't think if I had not gone to Renown, I don't think I would have pulled through the COVID at all.
We provide those tools to allow quick access to information, not just data, but information. But what makes us different is that we will sit side by side with those clinicians, with those physicians, with the administrators, and ask, what are your pain points?
One of the things that I think is important is we were looking at Masimo prior to COVID to assist us in helping expand our telemetry capabilities and our monitoring capabilities within the hospital itself, as well as learning very quickly about their SafetyNet technology and how we could use that directly for care in the home and as we were transitioning patients for care in the home.
And so I think we have this huge opportunity when we think about Nevada in particular, 7th largest state in size, and between 48th to 51st across the board in provider access, with 14 of the 17 counties in the state being rural or frontier. It makes it very challenging to think about how do those communities get the right care. Using telehealth, remote monitoring, I think is one way that we as an organization want to continue to expand our reach to ensure that all of those patients within that service range get the right care at the right time, no matter what the specialty is, no matter what the need is.
Patients love it, and why wouldn't they? If you've ever been ill or not feeling well, the last thing you want to do is be in a foreign place where you're eating food you don't like and you can't be visited by your friends, neighbors, and family. We've allowed an opportunity now where we can provide care with the utmost safety in people's home in a way that's convenient. They can sleep in their own bed, they can know that they're safe, they can eat their own food and be with their family and friends in a way that really helps the healing process.
I was back in the hospital about a week, and then they told me that I needed to go home with the monitors and keep track and be aware of where my oxygen level was at.
It was hooked up to a cell phone. I was able to see myself, and then they were able to call and check on me. So it was like what I like to call my guardian angels, yeah, in the flesh, yeah.
Evidently, they didn't. I slept through the phone calls. My husband's phone was downstairs, so I would have an ambulance crew at the door, just beating the door down, ready to tear it off.
I remember I was in a deep sleep, and I was like, why is this phone ringing? They said, Miss Lee, are you okay? I said, I'm fine, I'm sleeping. I was having a good dream. And they said, your sats are low, are you okay? And I was like, I didn't know anything about what I was feeling when I was asleep. And the next morning they came and they swooped me in the ambulance and brought me to the hospital.
When you get on the phone with them and they're very scared, they don't know what's going on, and we have to call an ambulance for them and they get readmitted, it really puts things into perspective because they may not have thought that they were that ill, and then we're calling an ambulance for them and they're being readmitted. I've heard so many times how we've saved their life.
Capacity is constrained everywhere, not just because of the pandemic we just are coming out of, but it's just healthcare is at a different place right now. So I think we need to meet patients where they are, provide the care that they need in the most appropriate environment that's cost effective, that's stopping them from getting acutely ill, and have a feedback loop between the healthcare providers and the patients.
I see this as the future. I really do. Of course, we'll always have hospitals. You need to have patients be seen in person, but I think there's so many things that telehealth can do in general.
Healthcare is at times rapid in change, and it's sometimes resistant to change. This is something that, without a doubt, the community of healthcare across the world needs to adopt, and that's because it helps patients directly. We've seen it, we have data for it, and we're all in.